Here. Okay, so Mycobacterium tuberculosis is an organism that causes TB, tuberculosis. It actually you can't really stain it with gram stains. They typically are not either gram negative or gram positive, right? But we do called the Zeal-Nielsen or acid fast staining, and uh, And when we say, oh, an acid fast staining is that you give a stain and the stain will go into the bacteria, but you give it a little acid and you wash it off. Most of the time the stain will come off, but because this organism has a thick mycolic cell wall membrane, the bacterium sticks inside, the stains stick inside the bacterium, and they will often look red like this. Okay, so we call it acid fast staining. And typically, you could do, in this case, they took the sputum, which is basically you coughed it off. That's, you get a little thing that comes out. That's known as sputum. And you can test to see whether the bacteria is in the sputum. Or you take the lung tissue, for example. And pathologists, oftentimes, when they get a specimen and they want to know if that person has TB or not, they will actually take the tissue and stain it with acid fast, and they will go through the slide. They go up, across, down, across, up, across, down, and so forth. And they're looking for these. If they see this, then they know the person that's confirmative that the person has TB. If you don't see it, that doesn't mean that they don't have TB. Okay? It just means that you don't detect them yet. But this is confirmed. If you have this, then we know you have TB. They describe this as, as if you're going fishing or salmon fishing, if you will, because of the red color. All right, as I mentioned to you earlier, that 5% of the people will develop this primary progressive TB, right? But 95% of the population is will, after the initial infection, they might get fever a little bit, but then they recover. This is known as into the incubation state, okay, or latent infection. And usually they develop, and you can see this called a Guin particle, which is a heel um, primary infection usually. And unless you have some kind of uh, immunosuppressive drugs, or when you really severely stress, or even though you have taking, or you might taking infliximab and monoclonal antibody toward TNF alpha, then we'll call it the reactivation. And reactivation is known as secondary TB. Okay, so I'm going to write this down. This is known as dormancy, and this is reactivation. And up here is like could be due to taking infliximab or just general dexamethasone. And then, of course, in both of these cases, particularly primary biliary TB, what you will see is that they're small granule that look like granule, hence the name biliary TB, miliary TB. Okay, they can spread, so you can see in the lung, or you can see it in the spleen. Secondary usually spreads this to the blood. Here's also spread to the blood to the left and get miliary. Okay. This is a primary healing, also known as a Guin tubercle or particle. The hilars is where here would be considered as your respiratory, your trachea, and then you have your primary bronchus that goes into the lung, and in these hilum is where typically when you get a TB infection, uh, oftentimes the superior lobe, right, tends to be more infected, and that is because if you look at the lobe, there's three. Right lungs, you have three lobes, superior, middle, inferior, but it's the superior lobe that get a lot of oxygen. That's where you get a lot of infection, typically in the superior lobe. Here it tells you is a going tubercle calcified scar. This is from a primary TB that is healed, and you might see that some in the calcified um, lymph node as well. Secondary tuberculosis. Now this is usually due to reactivation. Okay, and here's the apex of the lung, and you can see how this right here, lesion right here, if you fix this tissue and cut it, you will see it's crumbly. Right, so this is also defined as caseous necrosis, if you will. Okay. And again, we see a lot of that reactivations or TB infection is toward the apex of the lung because that's a lot of oxygen. They did this study with rabbit, and they find out, rabbits on its 4 feet, and usually it is toward the top surface, like around here, of the lung of the rabbit that usually get infection. So what they did is they say they have the rabbit on its 2 feet, right, and see what happened. And if you infected the rabbit on its 2 feet, you see that the infection now more to the apex, suggesting that that's the area where we get a lot of oxygen. All right, so fungal infections. So we're pretty much finished with virus, bacteria. Then we just need fungus and parasite. Fungus infections, we have two kinds. They're single organism like Candida, okay, and mycosis. And it actually, how they get into which form, it usually depends on the temperature, in fact. Body temperature 37, they usually in the yeast form, but they can sense out these hyphae, and the hyphae or the multicellular usually when at lower temperature. Okay. Now, when you get a fungal infection, it's known as mycosis, but there are many kinds, but we're just going to talk about the deep mycosis and what are the four deep mycosis that causes serious problems in our body. And the four deep type of mycosis are blastomycosis, coccidiomycosis, cryptococcosis, and histoplasmosis. Okay, these are different kinds of fungi. The reason I put it in brackets because I want you to appreciate a couple of things about how these fungal infection and be able to differentiate them. Now, for most of us, if we are healthy, the fungal infection we can pretty much recover from because the active immune system can get rid of them. Only when people, for whatever reason, their immune system is suppressed, right? Then they have this problem. And the common populations are, of course, AIDS, right? The CD4 count is low, immune system is weak. People are general immunosuppressed in general because they're transplant patient. You don't want the immune system to reject their tissue, the new heart or the new kidney. So they take immunosuppressive drugs to prevent their immune system from rejecting. Although now there are drugs that could target cytotoxic T cell, for example, just um, targeting specifically cells that involve in tissue rejection, as opposed to general immunosuppressive, whose target both humoral immunity and cellular immunity, which means targeting both B cells and T cells. So that's an important thing to think of. And then again, different type of fungal infections, you have to know where this person might come from, because blastomycosis maybe not very common in New York. In New York City, you get more cryptococcosis, for example, and that's because this is transmitted by pigeon, right? Whereas other there might be transmitted by bat, or there might be in certain area where it's dry, inducible for the fungal spores to be passing around, and that's where you might inhale the spores. Okay. All right. So here are some key important that I mentioned to you. In Cryptococcus neoformans, usually one will get it through pigeon dropping. Okay. Again, you don't get sick. The coccidiomycosis, usually very common in the southwest of the United States, because the air there is dry, like around New Mexico, Arizona kind of area, and the fungus is producing these spores, right? And you're going around and you inhaling that spores. For most of us, it's okay, but if you are, say, within this group category, HIV, AIDS, or organ transplant patient, corticosteroid, or patient, again, remember I talked to you about infliximab, how it's a monoclonal antibody against TNF alpha, used for treatment of rheumatoid arthritis, but now they use it for psoriasis as well, which is usually dry lesion that affects the skin around the elbow joints. Autoimmune disease, in fact, that's known as psoriasis. Blastomycosis is usually finds in people that go hiking, for example, decay in wood, for example, and then you have histoplasmosis. This is common transmitted within the bat feces, if you will, also known as the Ohio-Mississippi River. So within that area, I guess you can call it the Blue Mountain Ridge area. That's where you might see a lot of these histoplasmosis. Again, all of these people tend to be okay if you're normal, but when you are immunosuppressed, then you get sick. Okay. So deep mycosis, different kind. I'll probably give you some of the hints, like pigeons, and it's cryptococcus. If it's bad, it's histomycosis. Southwest is regions would be coccidiomycosis. And if you're hiking deadwood, that's where you find blastomycosis, if you will. I don't really want you to think of what the name of the organism is. Again, deep mycosis, usually lung. Deep mean lower mycosis fungal infection. They develop flu-like, usually coughing, fever, chest pain. And it's not uncommon that when someone who's coughing, persistent coughing can lead to chest pain, because those intercostal muscle and pectoralis minor, and to some extent the abdominal muscle play an important role in breathing or forced inhalation or forced exhalation, or even in coughing, and you do extensively, your abdomen area could be, stressed. Okay, so that's all I'm going to talk about fungal infection, um, and maybe pneumocystic cerevisiae, which is part of HIV. All right, so what this slide shows is when we talk about parasitic infection worldwide and how um, there seems to be many, many million people um, or die from parasitic infection. And most of these is also because, unsanitary conditions is usually what causes that. Um, and there are many kinds. Malaria now is particularly, well, you can see here is like nearly a quarter billions of people are infected with Plasmodium falciparum, which causes malaria, but not nearly as much death from that. And that's just because um, there's drugs that you can use to treat malaria, and to some extent, malaria can be vaccinated for Plasmodium falciparum, but it doesn't work too well. Uh, Hydroxychloroquine, which is basically a drug that during Trump administration uh, have suggest that you could take against coronavirus. It turns out that it doesn't do anything. Why did they recommend it? I don't know. Maybe his friend owned company, but that's hydroxychloroquine is for malaria. That's what originally intention for. Leishmaniasis, again, usually through water, amoeba, water, giardiasis, and the worms, sometimes intestinal nematodes, usually from eating uncooked pork, for example, raw pork. So never eat beef. You can eat raw, but not pork or chicken. The chicken you can get salmonella. And a lot of these, when you hear about salmonella outbreak, it's usually often associated with people eating like hollandaise sauce, uh, because it's used from raw egg, for example. So yeah, important to cook your chicken thoroughly and your pork as well. Filariasis causes by Wucheria bancrofti. It's um, infected by mosquito bite that delivered these parasite, and the parasite usually stays within the lymphatic uh, uh, system, so thus it's interfere with the lymph drainage. Usually the trunk, the lower extremity, can get, the leg can get really big. Uh, they develop a condition known as elephantiasis. Um, that's filariasis. Schistosomiasis, also another parasitic infection, and of course the tapeworm. All right. This is transmitted. The schistosomiasis is the snail fever, also abdominal pain, diarrhea. And then geriatritis is usually camping. People drink contaminated water. It's also known as beaver fever. Giardiasis, called giardia, which is parasitic infection. Kind of looks something like this. That's it. That's how I remember them. Parasitic infection. All right. So they are infections. If like Plasmodium, falciparum is a unicellular, okay, plasmodium. It's in fact infected red blood cell, and it causes malaria. And typically they're at different stages. I don't think we need to know different stages. The ring stage is, the trophozoite stage and so forth. But as they mature, and they will leave the red blood cell, and upon exiting, it's destroy red blood cells. So that's when red blood cells goes down, hematocrit goes down. A person might have fever, and then the body make more red blood cells. They recover, and then they have another episode of high fever. So it's very episodic with malaria. You get high fever, recover, high fever, and recover. Okay. Protozoa, single cell helminth are the worms. Usually these are multicellular. Worm can actually go, like that long, okay, in terms of pathogen wise. And then there are some parasite which consider as ecto mean on the surface of. There are many kinds. There could be scabies right here, and the scabby. I have to give you a clue that they're usually infected the web of your fingers, for example. Okay. Um, I guess you can say scabby is caused by mite, and the name of the mite is Sarcoptes scabii. Sarco mean body. Okay, so they infect anywhere in our body, but typically common in the web of the hand, for example. And there's a variation known as hominis, which is human. Vector-borne malaria transmitted by mosquito, Rocky Mountain spot fever, tick, lice or chiggers, Lyme disease, deer tick, plague caused by rodent. It's caused by bacteria Yersinia pestis. I would say that the other one that transmitted by mosquito is my own work when I was on sabbatical leave. It's the dengue virus. Or dengue virus causes dengue fever or dengue disease. Dengue, sometimes in Sri Lanka, they can call them as dengue disease. And there are 4 different kinds of viruses. And typically, if you get infection of one virus, you recover, that's fine. But if you get an infection with another virus, that's when you can get hemorrhagic. You can get a lot of fluids loss. And the idea that is put forward is known as the original sin hypothesis, which means that because you have the first viral infection, the subsequent infection, even though it's with different virus, it prevents you from having the immune system to fight against it. So this is known as the original sin hypothesis. And that's where people get fluid loss, and you have to maintain the fluid. Otherwise, low fluid could lead to low blood pressure, and you can develop hypovolumetric shock. Again, I want to remind you guys to listen to the recording on the fluid dynamic. Okay? Here is the Plasmodium falciparum in the red blood cells, and it's at different stages, the ring stage. And whenever time they come out, they will destroy the red blood cell, if you will. In this case, what we consider as when we talk about the red blood cell and what can cause anemia, low red blood cell, you can think of is the destructions of the red blood cell in the um, blood vessel. So we call that intravascular hemolysis, or it could be outside of the blood vessel, like in the liver or spleen, or maybe you don't have enough red blood cells because you're missing a factor required to make it, like vitamin B12 deficiency, iron deficiency, and so forth. We kind of covered this already. Sexual transmitted disease, I would just uh, recall to you that make sure that you know syphilis is very common with the 4 stages, gonorrhea, chlamydia, and I would say that Neisseria gonorrhea, again, Diplococcus gram-negative, sexual transmitted disease, uh, chlamydia, uh, if untreated chlamydia can cause the damage of reproductive organs. It's the most common sexually transmitted disease. It is 50 times more common than syphilis and 3 more times than gonorrhea. In the female, typically large vaginal discharge, bleeding. Um, Typically, um, when there is in a female, um, you know how one would have regular menstrual cycle, and if you started to have bleeding outside that menstrual cycle, then it's always a concern, right? It could be chlamydia. It could also due to endometriosis. It's just basically abnormal growth of endometrial tissue at some other area. And so that's also a concern. And of course, chlamydia, um, when your body tells you that, sexual intercourse and it's very painful, then that means there's something wrong. Okay. In male too, urination, and it's very painful. And when you look at your urine, it should be clear, a tint of yellow maybe, but if it's more pus and milky, then it is, um, that's pathological. It's sexual transmitted disease associated with chlamydia. Um, Trichomoniasis, caused by this kind of like Giardia in a way, but this is the amoebic sexual transmitted disease. Or gonorrhea caused by bacterial sexual transmitted disease. All right, so here is what I think that is important for you to study: the difference between gonorrhea and trichomoniasis, also known as a trich, right? Very common causes of vaginitis in female. It is a sexual transmitted disease. In trichomoniasis, it's caused by a single cell protozoa parasite, Trichomoniasis vaginitis. And I think that's pretty much self-explanatory down here. Gonorrhea is usually caused by Neisseria gonorrhea, right? Again, that Diplococcus gram-negative. But in a lot of times when people get gonorrhea, particularly female, they're asymptomatic, but they can transmit that disease. Remember, trichomoniasis is caused by a parasite, okay? Whereas gonorrhea is caused by bacteria. Chlamydia, we mentioned already, is the most common sexually transmitted disease. Human papillomavirus, you can be vaccinated for. Syphilis, caused by Treponema pallidum, and there are different stages of the syphilis. Well, this is basically two other kinds. A cancroid caused by Haemophilus ducreyi, and this right here, okay, and what would the cancroid is described here is usually is there's um, a lesion and but there is usually a depression within that lesion, if you will. Okay, it's painful, soft, has sharply defined borders, has a base, and covered with gray, yellowish gray material. And in this case, Muscicum contagium is caused by a virus. Um, he is itchy, uh, it's redness, and sometimes it's very could be very sore. All right, cancroid, it actually can break and cause ulceration, if you will. Muscicum contagium caused by a pox virus. Right? Commons in children, and here's where the mus the Muscicum contagiums, where you start seeing the dimple, if you will, within that lesion. That's for that's you can review that right there. I just want to say a couple more things um, with sexual transmitted disease. Bacterial infection, you also increase neutrophil, right? And again, Diplococcus gram-negative, that's Neisseria gonorrhea. Syphilis, there are 4 stages. The primary stage we see is a canker occurring. Secondary, they may have enlarged lymph node, but usually you see the skin lesions in the palms of the hand, if you will, or the soles of the feet. And they usually stay dormant for many years, called stage 3. And then stage 4, the tertiary stage, they come back out, and it could be years later. And then that's when they started to have cardiovascular disease, and they may have abnormal gait as well, neurological symptom as well. Syphilis is caused by Treponema pallidum. Canker, and you need to have a special stain, silver staining to see these. Otherwise, it's really hard to stain the syphilis. Usually culture them. I'm not going to talk about too much of them. All right. And then, or you can culture them in different kind of plate, like McConkey plate or blood agar plate. This is to distinguish different kinds of Streptococcus, for example, because they could produce different enzyme that sort of like shows you different colors of ring around it. Or another way that people do is they call antibiotic sensitive tests. And what this does is that you take the bacteria and you make a lawn of the bacteria. So this place has similar bacteria. But if you wanted to test to see the effectiveness of different antibiotics, what you could do is you put, a little paper disc, and then you add, maybe 10 microliters of antibiotics in the disc, and as the antibiotic, it diffuses from this piece of paper, right? And if they get bigger zone of inhibition, right? So the bigger the zone of inhibition, so that means, let's say this right here called zone of inhibition. Meaning that antibiotic is very effective because the antibiotic is slowly diffusing out. So you can say the further away from it, meaning you have a low concentration. So even at that low concentration, it prevents the bacteria from growing, right? So that's we consider as nanomolar molar range as opposed to micromolar range. And so in this case, for example, E, smaller growth of inhibition, is the least sensitive antibiotic. So this is like, this antibiotic is no good, for example, right? Um, this antibiotic, okay, is okay, but the best antibiotic is one right here that has the bigger zone of inhibition. All right, I'm going to stop there. Are there any questions?